All right. With that, we'll move back over to the slide presentation and talk about some of the vaccination concepts here. And the first thing I wanted to do is cover for the public, kind of at a high level, the vaccination concept of operations from the federal government all the way down. And the federal government has dictated the rules for how this is kind of supposed to work. So we've all heard about Operation Warp Speed. This was the federal program that was intended to get vaccinations produced and moving. And the feds have said that they're going to supply the vaccine and the supplies to administer the vaccine under Operation Warp Speed. And they're going to manage this process. I shouldn't say manage. They're going to guide this process utilizing the CDC, the Center for Disease Control's Advisory Committee on Immunization Practices, or the ACIP, which we see commonly talked about in documents related to this. And this is, in essence, the federal oversight that dictates to the lower levels of government how this is all supposed to work. And one of the first things that they dictated is that they're going to provide the vaccine, but the process is going to be state managed. And in Pennsylvania, that means that it is managed by the Pennsylvania Department of Health, who is the lead agency for public health in Pennsylvania. While some counties, and Commissioner Weinbach, I think you correct me about this number all the time, I want to say it's 7 counties and a total of 11 health departments.
It depends how you count Delaware County. It's 6 or 7. It's 6 without Delaware County.
Okay, so, and what he's referencing there is that Delaware County has engaged in an agreement with Chester County to kind of have the Chester County Health Department act as the Delaware County Health Department, for lack of a better term. So with respect to those entities, they are not autonomous. They still answer to the Department of Health under this process, with one notable exception, and that is the city of Philadelphia. The federal government has elected that in the largest jurisdictions in our nation, those entities will be treated effectively like states directly under the federal government. So in Pennsylvania, we kind of have to think of it as we have Pennsylvania and then we have Philadelphia. And Philadelphia has the same level of autonomy that the state itself does with respect to the federal government. So again, the point of that is to say that DOH is still guiding the activities of the health departments in the counties that have them. And those health departments have to perform their operations under the guidance from DOH. They're not autonomous. So in Pennsylvania, they've created a structure for this, which they've referred to as the PA COVID-19 Vaccination Task Force. This is a number of officials, primarily state government, although there is also engagement from the Allegheny County Health Department on this team. And this committee, in essence, develops the rules of engagement for vaccination in Pennsylvania. And they publish that through the PA COVID, what is currently called the PA COVID Interim Vaccination Plan. And I believe the term interim is intended to recognize that this is continuously changing. Right now, the version of the plan is version 4. All of the information that I'm presenting here is publicly available on the State Department of Health's website by simply Googling PA COVID vaccine, and it will take you to the DOH webpage, where there's then multiple link outs to various pieces of information about COVID vaccine in Pennsylvania. In addition, another important document that governs this is what is called the Vaccine Provider Agreement. And this is literally a legal contract that has to be signed between the provider of vaccine and the Centers for Disease Control. And the signatories to the contract, if you will, are the CDC and the provider of the vaccine, but the document recognizes that this is done in collaboration with the state authority, in this case, PA Department of Health, and compels the vaccine provider in certain ways. One important thing to realize is that the only eligible recipient to sign this agreement, the only people that can get vaccine, are licensed medical entities. Not county governments, not local governments, not a large corporation that has an interest in providing this service. To get vaccine, you must be a licensed healthcare provider in Pennsylvania. So we want to talk about a little bit how this changed from what the norms were and how the plans were written for many, many years. And up until approximately late October, there was still discussion about using what is called the SNS pod concept. And SNS is Strategic National Stockpile. This is a concept, if you will, a series of plans that have been in place for literally well over a decade, probably close to 2 decades, to be very honest with you, that speaks to how what is generally referred to as community prophylaxis will be handled. And whether this is the administration of a vaccine or if it would be the handing out of oral medicines after an anthrax attack or something like that, they are plans that speak to a pod or point of dispensing. And, very generically, this is some of what we see in the news where we see a public facility, an arena or a place like that turned into a place where people go in order to get the prophylaxis that's being offered. And through late October, we were working on that type of a concept in Berks County because we were told that that was going to be the beginning of this process. Closed pods, not open to the general public, open to certain categories of people, which I'll talk about in just a little bit, and where they were going to come and have to complete the necessary paperwork and registration within state systems to receive vaccine. This is not a simple undertaking. You need to have logistical capabilities at these locations. You need to have healthcare professionals who are capable of administering the vaccine. And any way you look at it, this was going to be, as I keep saying, a community as a whole approach to the vaccination process. However, at about the end of October, there was a shift, and DOH advised that let me step back a moment. Even when we were talking about these closed pods, DOH was saying that as vaccine became more readily available, the primary methodology of administration to the general public was going to be through their normal healthcare providers in the commercial pharmacy system. At about the end of October, DOH pulled that back and said that closed pods were not going to be the first methodology of delivery, that instead the health professionals and pharmacy operations were going to be the primary methodology of delivery right out of the gates. And that the recognition of these closed pods, or in some cases open pods, was going to be happening much later in the process as kind of a mop-up concept where we understand that there are certain folks in our community, particularly those who are financially distressed or otherwise underserved, don't have good access to the medical provider system as it normally stands. And in an effort to make sure that we capture those people, it was recognized that we may have to open up these community points of dispensing as walk-in opportunities for those folks to be able to access vaccine. But this front-end concept was taken off of the table. Another significant change to the norm is that usually we would see that anytime there's material coming down from the federal or state government, people who get that material have to agree that they're going to use it, they're going to provide it in a way that is coordinated and in concert with the government. There is no obligation that we can find that any of these providers that receive vaccine work with each other or work with local county government. They must work under the direction of the state government and under the direction of the federal government as it's laid out in their plans, but there's no further obligation that they work together. Now, clearly, that doesn't mean that we don't think they ought to be working together and that we want to bring all of these people together and get them, in essence, singing from the same sheet of music. But out of the gates, that obligation does not exist. And once they have the vaccine, they are free to do with it what they believe is the right thing to do, in concert with the rules being set forth by the federal and state government. So I want to talk a little bit about the statistics of where we are at the moment. And this slide shows vaccine that has been received in Berks up through the 13th, or yesterday. And I've broken this out by color groupings. I've organized it by the name of the recipient and then broken it out by color groupings for the 5 weeks of vaccine distribution to date to show when those, recipients received that vaccine in each week. To date, 18,000 doses of vaccine have been received by providers in Berks County, according to the data that the state is making available to us. We have asked them to provide this data in a forward-looking concept so that as new recipients are coming on board, we can try to reach out to them and get them in the fold and get them kind of working in a working group with other providers. But that data is not yet available. We only get this data in a retrospective fashion of who has already gotten it. It's worth pointing out that of those 18,000 doses received, 11,700 of them have been received by our 2 local hospitals and our Pfizer vaccine, the more difficult to handle ultra cold vaccine, and 6,300 doses are the Moderna vaccine, the still challenging but more easy to handle, not ultra cold vaccine. The next statistic we want to look at is vaccine administrations in Berks County. And we see Berks circled there, second from the bottom of the list as it's organized. It is important to recognize that these numbers, again coming from DOH, are based on the address of the recipient. So someone who went to a facility in another county to receive vaccine but lives in Berks County is in essence credited to Berks County. And it's very difficult to go back and forth between these statistics because we have to recognize that we talk about Berks County as a geographical location. We talk about Berks County as a geopolitical structure, the government of Berks County. And then we also reference Berks County hospitals, which of course are not part of Berks County. They're just located within Berks County. So you have to be careful as you move back and forth between these numbers to not believe that 18,000 vaccines received in Berks County means that 18,000 vaccines will go to Berks County residents, just like we don't want to believe that the approximately 9,000 Berks County residents who received vaccine got that vaccine in a Berks County location. They may have gone elsewhere to get that.
Brian, could you elaborate on the out-of-state 25,000 number?
I cannot. I honestly have no idea what that means, Commissioner. It came from the DOH. I wanted to make sure to put the statistic in there because it is so large. But the only thing that I can suggest is that it represents people who came to Pennsylvania and received vaccine in Pennsylvania despite having an address that is physically located in another state. There are no obligations to prove, again, just like our Berks County hospitals, they don't say, well, you're from Chester County, you can't have vaccine, or you're from Lehigh County. No different than our residents are going to other counties offering vaccine at the appropriate tiers to receive vaccine. One important caveat to this is we don't know if this includes FPP recipients. And many people may not know what FPP is, but just keep that in the back of your head for a moment. We are going to address that in a future slide. We are unclear whether these numbers include FPP recipients. So on the state vaccine website, they also provide a very nice GIS-based mapping tool that shows the locations of vaccine providers and whether the vaccine providers have received vaccine or have not received vaccine based on a green or red pushpin. And the concept here is ultimately to allow the public to understand where the locations are that have vaccine in the particular geography that they're interested in. These are the only push pins on the map currently that are within Berks County. That's why I didn't show the whole county. I zoomed in to get as much detail as I could to show the pins that existed. I will point out, as I show in the lower right-hand corner of the slide here, this is not 100% in sync with the distribution data, and again, we don't know why. Said very simply, if we go back 2 slides, there are facilities on this slide that, according to the DOH data, have received vaccine, yet are not represented on the maps on this pushpin. So again, I believe that DOH is working as quickly as they can in a very complicated process to try to get all the information out there, but we have to accept that it is not 100% in sync when you compare it across various ways of looking at it. So the next concept that we get to then is how the phases or tiering that we keep hearing about is supposed to work. And I would encourage everybody to go to the state DOH website and look at the vaccine plan as a whole. It's a lengthy document with a lot of detail. And I, of course, am trying to take some very granular information about the phases and tiering in that document and simplify it down to just a couple slides here for our discussion this morning. So please start with what I'm presenting and go back and look at that document and draw your own conclusions and make your own interpretations. So the first phase, one other thing I should mention before I go on, is that as the plan has changed through the 4 iterations that have existed prior to or including the one that is out there today, these phases have changed also. And I believe that they're going to continue changing based on information that we're hearing. So what I'm telling you is current as of me writing this presentation last night. Phase 1 is when we recognize that there is highly limited vaccine available nationwide, and that is where we are right now. There is not all the vaccine that we need for everybody to get it. And during this phase 1 process, DOH has broken it down into what were originally 2 and are now 3 tiers for administration. Tier 1 is long-term care facilities administered through the FPP. The FPP is the Federal Pharmacy Partnership. This is a program put in place directly by the federal government with major pharmacy chains to get vaccine into our long-term care facilities. And we're talking about skilled nursing facilities or assisted living facilities, what we all commonly refer to as nursing homes, but also other long-term residential facilities like drug rehabilitation facilities, like alcohol recovery facilities, like group homes. These are all part of what are looked at as long-term care facilities. And this is also outside of the auspices of the states. These are direct contracts from the federal government to these pharmacy providers, and the 2 pharmacy providers that are being used are Walgreens and CVS. And then those pharmacy providers are provided lists from the federal government of facilities that are to be reached out to and scheduled. There was an article in the paper just the other day about how Berks County is getting their vaccine the 28th of January, I believe is the first date. And I will mention that the original date of administration was the first week of March. And when we found that out, we were aghast. We reached out to DOH. DOH was aghast, and they then reached out to the federal partners, and subsequently we were able to get that date pulled back into the end of January. We have asked DOH to provide us with the information about all of the facilities in Berks County, which pharmacy is servicing them, and when they're anticipated to be serviced, so that we can try to anticipate if there are needs that are going to happen at those facilities, because somebody's got to be first and somebody's got to be last. I mean, that's just reality, and nobody ever wants to be last, but clearly not everybody can be vaccinated simultaneously. But for those that are going to be towards the back of the list, that may indicate the need for additional capabilities like push-in of state resources related to infection control and assessment, or PPE that will be needed for a longer period of time that may be less needed at facilities that are vaccinated early. We're having a very difficult time getting our arms around that data from DOH. So again, Tier 1A, long-term care facilities through the Federal Pharmacy Partnership, and healthcare personnel, I apologize this was cut off, but with emphasis on those with close contact to COVID patients. So again, we can't vaccinate every healthcare person first. That somebody's got to be first, somebody's got to be last. So the recipients are asked to do what they call sub-tier those people in ways that address what they do and who they interact with, of course, the emphasis being on those with close contact with COVID. Beyond Tier 1A is Tier 1B. And there are 3 ways that folks kind of fall into Tier 1B, and you could fall into more than one of these sub-reasonings. The first one is by occupation, frontline essential workers with close proximity to the public. Commissioners, you guys would not be Tier 1B because you don't have close contact with the public. You're generally working remotely, even though you're essential public workers. You're not those with close proximity to the public. You would fall into 1C, which I'm going to talk about in a bit. The second reason that you might fall into 1B is due to some condition, and the first condition would be age 75 and over. And again, the ask is that if there is not adequate vaccine available to give it to everybody 75 and over that would want it, they would first go to those with underlying health conditions. And then the third reason would be by what I refer to as living condition. For example, they live in a congregate care setting that is not otherwise considered a long-term care facility, or they're receiving home or community-based services. So those folks would all encompass Tier 1B. And the original discussion from DOH is that this would be done in a serial process. Now, we understand that somebody in 1A might get overlooked, or they may not have wanted vaccine, and 3 months later they then decide they do want it. So it's not like everybody in Tier 1A would get vaccine before moving to 1B, but DOH was very emphatic that this was a serial process where we effectively would be involved in vaccinating 1A before we move to 1B, and 1B before we move to 1C. I'll mention that has changed somewhat, but that is what is laid out in the plan, and that is the mindset. The next tier of phase 1 is Tier 1C. Again, a couple ways that you fall into this grouping. The first one is by occupation. These are other essential workers that don't necessarily have close public contact, but who are recognized in a fairly complex federal document that I won't go into detail about, but it's a critical infrastructure and key asset report that recognizes certain sectors of our society, like food processing and energy and those kind of things, as being critical to the functioning of our society. They would be the first grouping of Tier 1C. And then the second one is, again, by condition. Here we're looking at age 65 and over, or age 16 to 64 with high-risk conditions. Again, to the extent that there is an adequate vaccine for everyone in this sub-tier, then we would be asking, we are expecting the providers to look at people with multiple conditions or underlying health conditions in addition to their age first. And then finally, after there is ample vaccine, or what they call expanded supply of vaccine available nationally, then we would move to phase 2, which is everybody else that doesn't fall into phase 1. I will point out that if you begin to think about this, phase 1 is not a small group of people. There are a lot of people that fall into one of those categories under phase 1. And that, of course, is part of the challenge. As I said, somebody's going to be first, somebody's going to be last, and there are going to be a lot of people in between. So I'm going to pause there, commissioners, and ask if you have any questions about tiering, just because that is so important and so complex.
Let me share a question that is from the public, but it's specific to your report. So I think it's appropriate to address it now. And the individual doesn't have their residence here, so I'm not even going to read the name, but the question is a worthwhile question. Will you have an online registration for employers, individuals to sign up for the vaccine? And that probably will relate to what you found out yesterday from the Commonwealth plans.
Yep, that's a great question, Commissioner. I'm just going to ask that we put it on the back burner because I do address it in the presentation.
Okay, great.
Okay, so moving on from the tiering and phases of tiering, we just want to look at what DOH says about where the state is at today. And the state says that we are in phase 1A. In the opinion of DOH, vaccine should be being administered to 1A individuals. And there is no published timeline to move to 1B, but the Secretary of Health has stated that there will be more information about that the week of January 18th, which is next week, based on when this presentation is being given live. We want to talk about the known current conditions in Berks County, and this is current as of 21:45 hours last night when I typed on this slide. I can't tell you that this hasn't changed in the last 5 minutes or 5 hours. We are doing our best to stay on top of this, but it is a constantly moving target. There are 5 providers that we know are publicly reaching out and providing vaccine in Berks County in various ways. Beyond that, we know that there are other recipients of vaccine, some of whom have secured vaccine for the administration to their own healthcare personnel, which is perfectly allowable, and some of whom are making vaccine available to other groups that they feel an obligation to handling, but not doing it in a fully open public way. And again, there's nothing wrong with that. For example, a doctor's office that received vaccine may reach out to their local emergency providers or their local EMS agency or other doctor's offices that are near them that they work with readily and offer that vaccine under the current plan of administration to those individuals. The 5 that I'm showing you here on the screen are the ones that we know, as a matter of fact, are publicly advertising the availability of vaccine. They've done a press release, they put it on their website, something like that. And that is Penn State St. Joe's, who are presently doing Tier 1A administration, including unaffiliated healthcare providers. So even if you don't have any relationship as a doctor or a dentist or anybody else in the community that's delivering healthcare services, you can reach out to St. Joe's and be scheduled to receive vaccine at their location. Tower Health, Reading Hospital, same thing. They're doing Tier 1A, but they have also, as of yesterday, begun doing a limited Tier 1B administration. That included fire and law enforcement. And we know this because they provided us that information and asked us to help get that information out into the community, very specifically to fire and law. Now, I will say that we have been told anecdotally by folks in other Tier 1B groups, like crisis counselors and group home type facilities, that they have been successful in securing vaccine through Tower, but that is not presently part of their public release as we understand it. The Berks Community Health Center, who our department has worked very closely with, they assisted us in getting vaccine out to our EMS community as early as possible. And because they're a very small operation, their mission, if you will, is to serve the underserved community the underserved portion of our community. They aren't really big. They don't have a lot of outside looking resources like telemedicine and the ability to do online scheduling and those kind of things. So we kind of help them by handling some of those logistics and providing them lists of individuals that they then were able to ultimately vaccinate. I know for certain from talking to their leadership that they're also getting outreach from dialysis clinics and other smaller healthcare providers in the community that are looking to get vaccine for their personnel. And as a result of that, they're able to work to schedule individuals. So that's why I said that they're doing this Tier 1A by direct engagement. They're really, while they want to help and they want to do everything they can, they're really not set up to have individuals contact them. So they're hoping to hear from groups of people represented by that group's management team at like a healthcare facility who are willing to help bring together the demographic information and provide it to them so that they can help. And then St. Luke's and Lehigh Valley Health Network, who both have facilities in and around Berks County. I shouldn't say that. I think Lehigh Valley has facilities in Berks County. I don't believe St. Luke's has any in the county, but definitely around the county.
St. Luke's does. They're up in Hamburg. Urgent.
Oh, that's right. They have the urgent care on 61 now. I did forget about that, a fairly new facility. But they also have opened a hospital just north of the Berks County line in I guess technically in Orwigsburg along 61 there. So both of these very large health operations are offering vaccine at a number of their facilities and are offering it to Tier 1A and Tier 1B. Again, anecdotally, we know that teachers and other folks who are in that essential worker with public contact category are able to go to these locations and receive vaccine. So this merits the question of, well, what's this idiot talking about? He just told us that everybody has to follow the state rules, and that the state says that we're at Tier 1A, and now he's telling us about people that are doing limited Tier 1B and full Tier 1B. And the answer is everybody's trying to do their best. I don't think the state's going to come out and write tickets to people who are doing what they think is in the best interest of their community. And I don't think that any of our healthcare partners are doing anything wrong by getting the vaccine out in the way that they're trying to get it out. I can't give you a satisfying answer for why the state says we're still at 1A, yet we have multiple healthcare providers in the Berks County area doing 1B. I think that the best answer that I can give for the public is we should all do our best to take advantage of whatever opportunity is available in our community and pursue vaccine in the fastest, most efficient way that we can get it from where we can get it, not get wrapped around the axle of why there's a difference from one place to the other. Because the goal of everybody is to get past these tiers and get vaccine into everybody that wants it and that we can get it into. I think there's also a lot of discussion and consternation in the community about why we're giving vaccine to police officers, but not the elderly, or teachers, but not those with pre-existing conditions. And I personally struggle with some of those concerns, but I'm not a public health expert. I have a lot of opinions, and people that know me or will say that Brian is an opinionated guy. But I also think that I'm smart enough to know that my opinion is just that, an opinion. And there are people with expertise who are making these decisions at higher levels of government who have a greater knowledge and greater understanding of what's going on, and to some extent we have to trust that yes, they will make mistakes, but they're trying to do the right thing and they're trying to do the best thing. So this brings us to what is on the horizon, and we have heard definitively, we know for sure, there's a CCAP conference call with the Secretary of Health today at noon that I know that all the commissioners are intending to be on. I, of course, will be on it, and we'll be hearing the most up-to-date information available from the Secretary of Health at that time. We know that
CCAP, a lot of people.
I'm sorry, Commissioner. Yes, CCAP is the County Commissioners Association of Pennsylvania. It's basically the professional organizing organization that county commissioners in Pennsylvania belong to, that helps to kind of lobby for the counties and also to disseminate information to the county level and advocate on behalf of county government in Pennsylvania, whether it's with the state or the feds. Anything else you want to say about that, Commissioner? You're obviously a lot more tuned in than me. Okay. The other thing that we know for sure is that 2 nights ago, there was communication from the federal government to the states, and I say state, it wasn't just a PA, it was all the states, directing that the states begin vaccinating those folks that are 1B by condition immediately. So folks 65 and older and those with pre-existing conditions are now being effectively moved to the front of the line. And Brian Gottschall, this is one of those things that I've had consternation about. Why are we giving vaccine to otherwise healthy people in critical roles, but not giving it to the people most likely to succumb or have serious impacts from the illness? It looks like the feds are realigning their strategies and have pushed that information out to the state. The Secretary of Health announced this in a town hall that I participated in that was put on by the Democratic caucus of the state Senate. And she said at that time, like that town hall was at noon, she had a meeting at 1 o'clock yesterday with state officials to begin talking about how the state's going to accommodate this. And again, they have promised that they will have guidance about how this is going to open up by the week of 1/18, next week again from this live presentation. They have also advised us that there will be a statewide vaccine registry in 1 to 2 weeks. This is not a substitute for, the term registry is a little bit confusing. So this is not going to be how you schedule for vaccine. It's not going to be how you say, I want to come Tuesday at 2 p.m. It's where you're going to put your information into a database and say that you want vaccine. And this is the reason why you qualify for vaccine at a certain tier. And then the state is going to take that and match you up with a vaccine provider so that then you can actually be scheduled with that provider. So I hope I explained that well, and I hope it makes sense. But the state has acknowledged that that is necessary and is saying that that's going to come out in 1 to 2 weeks. We don't know whether there's going to be validation involved in that. And a lot of this is on the honor system. And of course, everybody hopes that the public as a whole will do the right thing and not lie about their affiliation or lie about having a pre-existing medical condition to get moved to the front of the line. There are counties that I'm aware of that are actively participating in the review of information that is being submitted, and in essence, calling people out and saying, well, you don't qualify and we're not supporting that you should receive vaccine. We don't understand whether the state is going to do that or not, or whether they're just going to do this as an administrative efficiency to get information onto the providers. And then the last thing is kind of what I would call our predictions. And I want to be very emphatic about that. This is based on the best information we have available and are trying to read the tea leaves, what we think is going to happen here. We believe that DOH is going to expand the current mandate to vaccinate beyond Tier 1A. Remember that I said that there is nothing that obligates vaccine providers to do anything with the vaccine other than use it internally within their own organization. So a doctor's office that asked for enough vaccine to vaccinate just their people had the right to do that. That changed effective on January 7th. Anyone who receives vaccine after January 7th is now mandated by order of the Secretary of Health to provide a minimum of 10% of the vaccine that they receive out to other unaffiliated healthcare providers, other Tier 1A people in the community. We think that the Department of Health is going to further expand that beyond Tier 1A and put obligations on people receiving vaccine to also vaccinate other tiers of people within the community. We also, and I know this is controversial and people aren't going to like to hear this, but again, we want to be 100% open with what we perceive to be the scenarios. We believe that there's actually going to be a slowing of vaccine administration in the next couple of weeks due to the need to get second doses out. And this is one of the complexities of this process that really was not anticipated in any planning that I've ever been part of developing or education that I've received from other levels of government about prophylaxis planning. We've never openly talked about the two-dose concept. We believed that we were going to have to kind of touch people, get them whatever they needed, their bag of antibiotics or their injection, and then move along to the next person. This concept of having to bring everybody back for a second dose, unless we dramatically grow the number of people who are giving vaccine, there are only X number of people who can stick X number of needles and X number of arms. If 4 weeks after the first vaccines were given, all those same people have to be seen again, that means that those people administering vaccine can't see new people to get their first dose at that same time. So it's a simple math problem that if we aren't growing the number of vaccination sites, the number of people receiving vaccine from the state, and the number of people doing those injections, you have to accept that there's going to be a slowdown as we start to get into the second dose administrations. We also believe that the federal government is going to allocate additional funding to the states to support this effort. There is what is commonly accepted to be very limited funding available at the moment, and I think that the states are actively lobbying for this and that they're going to start to see more money, and that's going to open up the doors then for the states to engage other means of administration, such as contracts with commercial pharmacies to become part of this process, or even contracting with healthcare systems to manage this process in certain counties or areas of the state. We also hope that there will be additional vaccines that receive the FDA emergency use authorization that are approved for single dose administration, which will make the process, of course, much easier. And we believe that most people will ultimately access vaccine, as DOH has said, through their physicians or their normal means of securing health care and commercial pharmacies. In essence, the same way that they go about getting their annual flu shot. The most important prediction that we want to make, because we want to be very honest with people and we want to control expectations, is that there will be people getting vaccine administered into the second half of 2021. Everybody wants it today. Not everybody's going to get it today. Not everybody's going to get it tomorrow, and not everybody's going to get it next month. That is a reality of the complexity of the process that is being dealt with here, and we would ask people, while we understand they may be unhappy, we understand that they have a right to voice that displeasure, but doing so at the vaccine providers, tying up their call-in lines or their email boxes as they're trying to do the best they can, is not really helping the situation. Everybody that's involved is doing what they can, and distracting them from that primary mission is not helpful to anybody, including you, the person that wants to get the vaccine. So that's the end of the report that I have to offer, Commissioners. Again, it's certainly not all good news. It's probably not even 100% thorough news. But I believe that it's the best we can offer at this moment in time.